Hello, Pharma friends. Welcome to Pharma Syndrome YouTube channel. And this is continuation of ANS MCQs explanation part 2. So part 1 already completed. So that is posted in our channel Pharma Syndrome. So subscribe to our channel Pharma Syndrome. Follow, like, share our channel. And if you are looking for pharmacist, drug inspector, GPAT, Sniper, competitive coaching, so contact me on 7995318110. And here, let's continue the question here. Next question is following alkaloid. So the following alkaloid is the reason behind naming of muscarinic receptor. Reason behind naming of muscarinic receptor. So, following alkaloid, which are the following alkaloid reason behind naming of muscarinic receptor? So, pilocarpine. So, pilocarpine, natural alkaloid from Pilocarpus jaborandi, belong to the family Rutaceae. And pilocarpine, biosynthesis by using amino acid, histidine, because histidine containing imidazole ring, pilocarpine also containing imidazole ring. And physostigmine also a natural alkaloid from Physostigma venenosum, and it is an indole alkaloid biosynthesis from the amino acid tryptophan because it containing indole ring and indole ring present in the tryptophan, which is a aromatic amino acid. And next is a mescaline comes under hallucinogenic agent, and the answer is the muscarine. Muscarine is from the Amanita muscaria, which is a mushroom, and muscarine is a agonist at muscarinic receptors or cholinergic receptor. So based on the muscarine name, the receptor named as muscarinic receptor. And there are 5 types of muscarinic receptors. All are belongs to G protein coupled receptors. So the answer is here muscarine. Based on the name of muscarine, the receptor muscarinic receptors as named. So the muscarinic receptor's name is because of muscarine. So next question. The next question is parasympathetic acetylcholine causes contraction of all type of smooth muscles except. So acetylcholine causes contraction of urinary bladder smooth muscle, contract the bronchial smooth muscle lungs, and contraction of gastric smooth muscle. But exception is blood vessel. On the blood vessel, when muscarinic type 3 receptors activated, they releases nitric oxide, which is a potent vasodilator, causes vasodilation on the blood vessel. And blood vessel is also a smooth muscle. So all smooth muscle under the acetylcholine parasympathetic system leads to contraction, but dilation or relaxation on the blood vessels, that is a exception. That is the exception. And even when coming to the sympathetic nervous system on all smooth muscle causes dilation. Exception is blood vessels. On the blood vessels, the sympathetic nervous system nor adrenaline causes vasoconstriction and increase blood pressure. Next, acetylcholine esterase enzyme inhibitor is. So acetylcholine esterase enzyme break down the acetylcholine into the acetate and choline. So acetylcholine esterase is a enzyme for breakdown of acetylcholine or metabolism of acetylcholine. So beta-nicol is not a ACE inhibitor, sorry, acetylcholine esterase enzyme inhibitor. Beta-nicol is a selective M3 muscarinic receptor 3 agonist. Methanicol is a selective muscarinic type 2 receptor agonist. And ericoline is a cholinomimetic. Ericoline is a cholinomimetic. And here edrophonium is a acetylcholine esterase enzyme inhibitor. Acetylcholine esterase enzyme inhibitor. And edrophonium is a diagnostic agent for the myasthenia gravis. So to diagnose myasthenia gravis, edrophonium used as a diagnostic agent because of its fast onset of action and లెస్ డ్యూరేషన్ ఆఫ్ యాక్షన్. సో తొందరగా యాక్షన్ చూపిస్తుంది, తొందరగా బాడీ నుంచి బయటికి వెళ్ళిపోతుంది. సో దెన్ దెర్ ఇస్ ఎ లెస్ సైడ్ ఎఫెక్ట్స్. And next question. Which of the following is a nerve gas? So regarding the classification of parasympathomimics, directly acting drugs, indirectly acting drugs. Directly acting drugs means directly they interact with the muscarinic receptor and shows the action. Indirectly acting drugs, initially they have to inhibit acetylcholine esterase enzyme. If the enzyme inhibited, acetylcholine levels increases. That increased acetylcholine interact with the receptors. That is muscarinic receptor. And here it is the which of the following is a nerve gas? So prolidoxime. Prolidoxime is a acetylcholine esterase enzyme reactivator. So that activates the acetylcholine esterase enzyme. Especially this prolidoxime is a drug of choice in organophosphorus poisoning. And next, ecothiopate. Ecothiopate is an organophosphorus compound, but not a gas. And isofluorophosphate also a organophosphorus compound. But the answer is tarbun as well as sarin are the nerve gases. SARIN. Tarbun as well as sarin. Both are nerve gases. And these two, both tarbun sarin are irreversible inhibitors of acetylcholine esterase enzyme. Irreversible inhibitors of acetylcholine esterase enzyme. And next question is, one of the following acetylcholine esterase enzyme inhibitor stimulate the nicotinic muscle receptor. So like muscarinic receptors in parasympathetic nervous system, there is also a nicotinic receptor. Muscarinic receptors belongs to G protein coupled receptor. Nicotinic receptors are belongs to ion channel receptor. Ion channel receptors also called as fast acting receptor. G-protein coupled receptors also called as metabotropic receptors or serpentine receptors or 7-transmembrane heptahelical receptor. Here the question is, one of the following acetylcholine esterase inhibitor stimulates NM, nicotinic muscle receptors is. Let's see here. So which of the following drug can stimulate NM receptor having the activity of inhibition of acetylcholine esterase enzyme? So here it is the tacrine. Tacrine is a irreversible acetylcholine esterase enzyme inhibitor, but not stimulate NM receptor. Physostigma, natural alkaloid from Physostigma venenosum, belong to the family Leguminaceae and chemically contain indole ring, so biosynthesis from the tryptophan. And pyridostigmine is a semi-synthetic acetylcholine esterase enzyme inhibitor, does not stimulate NM receptor. And neostigmine can stimulate the NM receptor, nicotinic muscle receptor, and also inhibits acetylcholine esterase enzyme. Acetylcholine esterase enzyme. And next following question is, all types of muscarinic receptors are belongs to. So there are 5 types of muscarinic receptors are there like M1, M2, M3, M4, A5, M5, and all are belongs to G protein coupled receptor. G protein coupled receptors also called as serpentine receptors or metabotropic receptors or 7-transmembrane heptahelical receptors. And intracellular receptors means present within the cell. Intracellular receptors also known as nuclear receptors or steroid receptors or cytosolic receptors. So for a clear view on receptor, pharmacology of receptor, I also made a video on our channel in Telugu as well as English also. You can watch receptor 1, receptor 2. So clear view on the receptors, because receptors are formulas for pharmacology. If you have a knowledge on receptor, definitely you will get a grip on the pharmacology subject. And catalytic receptor also called as enzymatic receptor. Fast acting receptors also called as ion channel or inotropic receptor. So the muscarinic receptors belongs to G protein coupled receptor. The G protein coupled receptors also known as serpentine receptors. That is the answer. Next, which are the following drug which of the following drug used in treatment of post-operative urinary retention? So, after surgical procedure, it is difficult to a person to eliminate the urine because due to the surgery, he is in relaxation condition. So, in that condition, wantedly, the excess urine from the surgical patient person eliminate easily by using drugs. So here, pilocarpine is a drug of choice for glaucoma. Ecothiopate, also a drug of choice for glaucoma. And carbachol, also a drug of choice of glaucoma. And betonicol is a selective M3 receptor agonist, stimulate the smooth muscle of urinary bladder and increase the elimination of urine in the post-operative patient, the patient who is already have the surgery. Next, sialagogue means. So, sialagogue means sialagogue means. So, sialagogue means that increase the secretion of. So, sialagogue is a term that means increasing secretions of saliva. So, sialagogues are the agents or substance increase the secretions of saliva by stimulates the salivary glands, by stimulating the salivary glands. Next question. So, next question is here. Which of the following cholinomimetic acts on heart and decreases heart rate? So, cholinomimetics, also called as parasympathomimetics, regarding definition, they mimics the acetylcholine function on muscarinic receptors. So, betonicol is a selective M3 receptor agonist, and galamine selective M2 receptor blockers on heart. Glycopyrrolate is also a muscarinic receptor blocker, non-selective generally, but methacholine is a selectively agonizes M2 receptors on heart and it decreases heart rate. Why heart rate decreasing? So, muscarinic type 2 muscarinic receptors present on heart to the muscarinic receptor, acetylcholine will bind. If acetylcholine will bind and agonize M2 receptor, heart rate will be reduced. So, in the tachycardia, excess heart rate. To reduce that excess heart rate, M2 receptors can be useful, which decreases heart rate because there is a ligand acetylcholine. So, acetylcholine is a neurotransmitter in parasympathetic nervous system. The role of parasympathetic nervous system on the heart is decreasing heart rate, decreases number of contractions, decreases number of beats, and decreases conduction velocity, finally decreases cardiac output. Next, in organophosphorus poisoning, diazepam or midazolam used to control. So organophosphorus poisoning is nothing but it is a poisoning the condition in which excess concentration of organophosphorus compounds increase in the body. It may be from the pesticides or herbicides. So increasing organophosphorus poisoning inactivates acetylcholine esterase enzyme. Inactivation of acetylcholine esterase enzyme increases severe levels of acetylcholine, that is organophosphorus poisoning. So, in the organophosphorus poisoning, diazepam or midazolam are used to control convulsions because diazepam or midazolam are GABA A receptor agonist, increase the Cl minus conductance into the brain cells and decreases convulsions by producing inhibitory neurotransmission. So, not for the muscle paralysis, not for the heart rate, not for the excess bronchial constrictions, not for the excess bronchial constriction. Next, next, acetylcholine esterase enzyme reactivatories. Acetylcholine esterase enzyme reactivatories. So generally, in the organophosphorus poisoning case, there is inactivation of acetylcholine esterase enzyme. So inactivation of acetylcholine esterase enzyme leads to severe increase in acetylcholine levels. If acetylcholine levels increase in severe, so there is a increased constriction of pupil of eye, increased salivary secretions, increased bronchial muscle contraction, decreasing heart rate, increasing gastric movements. All this may lead to the harmful or damage or death to the patient. That's why we have to reactivate acetylcholine esterase enzyme in organophosphorus poisoning. If enzyme reactivated, that enzyme degrades or metabolizes excess acetylcholine and controls meiosis, controls excess salivary secretions, and controls bradycardia. And the enzyme reactivator is here pralidoxime. So pralidoxime chemically contains a oxime, highly nucleophilic group. That oxime reactivate the acetylcholine esterase enzyme. So trizolam is comes under benzodiazepine group, and atropine is a muscarinic receptor antagonist. Non-selectively blocks all muscarinic receptors. Next, which of the following ganglionic stimulant used to control smoking addiction is? So one of the following is a ganglion stimulant. Stimulate ganglionic receptor, NN, nicotinic neuronal receptors, and that control smoking addiction. So lobeline. Lobeline is generally called as asthma weed from the lobelia. And vernicline is a correct answer for treatment of smoking addiction. It is a ganglionic stimulant. And neostigmine is a acetylcholine esterase enzyme inhibitor in the category of reversible inhibitor of acetylcholine esterase enzyme. And gabapentin is a not a ganglionic stimulant. It is not a ganglionic stimulant. Generally, it related to the action on GABA receptors. And next question. Which of the following? Next question is, which of the following anti-muscarinic agent used as a pre-anesthetic agent? So dicyclamine is not a pre-anesthetic agent. Solifenacin, not a pre-anesthetic agent. Pyrazipine, a selective M1 receptor blocker in the GIT for the treatment of ulcer. And the answer is glycopyrrolate is a anti-muscarinic agent with a pre-anesthetic action. With pre-anesthetic action. Next, anti-muscarinic agent used in irritable bowel syndrome is. So the anti-muscarinic drug used in the treatment of irritable bowel syndrome is. So pilocarpine for the treatment of glaucoma, solifenacin useful for treatment of problem with urinary bladder, telenzapine is a drug of choice for not a drug of choice for irritable bowel syndrome, and the flavoxate, sorry for my inconvenience, solifenacin is a drug of choice for treatment of irritable bowel syndrome. So bowel syndrome related to the intestine. So due to excess stimulation of ZIT because of muscarinic receptor stimulation, there is irritation in the bowel intestine. To regulate that excess stimulation, excess irritation, we have to block the muscarinic receptors in the GIT using using solifenacin. Solifenacin is the answer for treatment of irritable bowel syndrome among the drugs. So receptors present in adrenal medulla. So nicotinic NM receptors present in the skeletal muscle, motor end plate, and dopamine receptors present in the GIT as well as CNS, and glutamate receptors present in the central nervous system. And glutamate is a excitatory neurotransmitter in central nervous system. And nicotinic NN, nicotinic neuronal or ganglionic receptor present on adrenal medulla of adrenal gland. If adrenal medulla is stimulated due to activation of NN receptor, there is a release of adrenaline from the adrenal gland. So release of adrenaline because of binding of acetylcholine to NN receptors in the adrenal medulla. You know, adrenal medulla releases adrenaline and adrenal cortex releases hormones like glucocorticoids. Next question. So regarding next question, which of the following drug is not a competitive neuromuscular blocker? So regarding the neuromuscular blockers classification, neuromuscular blockers are the drugs blocks the neuromuscular junction in the skeletal muscle by competing with nicotinic muscle receptors or antagonizing nicotinic muscle receptors. So here, vecuronium is a competitive or non-depolarizing neuromuscular blocker. Rocuronium also same, competitive or non-depolarizing. Gantacurium is also a competitive or non-depolarizing. And decamethonium as well as succinylcholine are the two drugs comes under the non-competitive or depolarizing neuromuscular blockers. Depolarizing neuromuscular blockers. So the answer is the decamethonium. Answer is decamethonium. So continuation here, the next question. Continuation here, the next question. Which of the following drug is not a non-competitive or depolarizing neuromuscular blocker? So I already told that in the previous MCQ, neuromuscular blockers are two categories: non-competitive or depolarizing, non-depolarizing or competitive blocker, or competitive blocker. So here succinylcholine is a non-competitive or depolarizing blocker, remaining rapacuronium, trimetaphan, atracurium. So trimetaphan is a ganglionic blocker. Rapacuronium, atracurium both are competitive or non-depolarizing neuromuscular blockers. Non-depolarizing neuromuscular blocker. And going to the next question. So regarding the next question, tachyphylaxis or desensitization of skeletal muscle observed in mechanism of succinylcholine. Succinylcholine is a neuromuscular blocker, peripherally acting neuromuscular blocker. Regarding mechanism, initially it produces depolarization which stimulates skeletal muscle, but continuously it produces partial depolarization which are not sufficient for a full muscle contraction. Because of the partial depolarization, the muscle become fatigue, tachyphylaxis or desensitization. That is, you can observe in the mechanism of a succinylcholine. So, tubocurarin directly blocks NM receptor like doxycurium as well as metocurine. And answer is the succinylcholine. So, tachyphylaxis or desensitization, you can observe in the mechanism of succinylcholine. That is meaning of fatigue of skeletal muscle. The skeletal muscle is not responding. Not responding. And next question here, just a second. Analog of gamma cyclodextrins used to reverse overdose of non-depolarizing neuromuscular blockers like rocuronium, pancuronium. And the answer is Sugamadex. It is a cyclodextrin analog. It used as an antidote for overdose of rocuronium, pancuronium, especially non-depolarizing or competitive neuromuscular blockers overdose. And decamethonium is not an answer. And Sugammadex is the answer. And Mivacurium also not an answer. And quinine is anti-malarial, which is a actoisomer is L isomer. So that is you already know. And continuation, next question, Half-Mon elimination. Half-Mon elimination. So this question is appeared in the 2012 GPAT. So Half-Mon elimination involves in the metabolism of atracurium is the answer. So atracurium metabolized in the liver by the process of Half-Mon elimination and gives the metabolite ladanosin, Laudanosin. Ladanosin is a metabolite of atracurium, causes convulsion. And atracurium metabolized by a process called as Half-Mon elimination, the liver. Next. One of the following drugs blocks ryanodine receptors on sarcoplasmic reticulum is. So sarcoplasmic reticulum means present in the skeletal muscle. So activation or opening of sarcoplasmic reticulum releases calcium and that needs ryanodine receptors. Ryanodine receptors present on the sarcoplasmic reticulum. Role of the sarcoplasmic reticulum to store the calcium and release the calcium when required. So here dantrolene is a drug blocks the ryanodine receptors on sarcoplasmic reticulum and it decreases the release of calcium from the skeletal muscle. So cis-atracurium, a cis form of atracurium, which is a peripherally active neuromuscular blocker, and succinylcholine is a depolarizing neuromuscular blocker, and gantracurium also a commutative neuromuscular blocker. So dantrolene is a drug used in the treatment of malignant hyperthermia, the condition in which increased severe body temperature due to continuous release of sarcoplasmic reticulum. So here, this continuous release of calcium can be inhibited by blocking of ryanodine receptor on the sarcoplasmic reticulum by using a drug known as dantrolene. So dantrolene is a drug of choice for treatment of malignant hyperthermia. So malignant hyperthermia is a drawback or side effect of succinylcholine as well as lithium carbonate and also halothane. So succinylcholine can cause drawback like malignant hyperthermia. Choose odd one. So pimpidine here, mecamylamine, hexamethonium, as well as rapacuronium. Rapacuronium. So rapacuronium is comes under the commutative neuromuscular blocker or non-depolarizing neuromuscular blocker. So, and remaining hexamethonium, mecamylamine, pimpidine are these are blockers. These are ganglionic blockers. But rapacuronium is a NM blocker, nicotinic muscle receptor blocker present on the neuromuscular junction. And last question is here. All competitive or non-depolarizing neuromuscular blockers produces bradycardia, but one of the following drug produces tachycardia. Tachycardia. That is, the correct answer is pancuronium as well as galamine. So, varenicline is a drug for treatment of smoking addiction and it is a ganglionic stimulant. Varenicline is a ganglionic stimulant. It is a drug for smoking addiction to reduce smoking addiction. So, pancuronium galamine blocks M2 receptors on heart and increases heart rate. Generally, agonism of type 2 muscarinic receptors on heart decreases heart rate and produce bradycardia. But here pancuronium galamine block M2 receptors on heart and increases heart rate. Okay, so this is simply part 2 of autonomic nervous system MCQs with explanation. I hope you will get a you will got some knowledge on this. So subscribe to our channel for daily updates and pharma coaching. So if you're having any doubts or any queries, you can contact me on 7995318103. If you are looking for GPAT, NIPER, pharmacist, drug inspector coaching, so you can contact us on 7995318103. So the number also mentioned here. So thank you. We will connect in the next session. And part 1 MCQ with explanation of autonomic nervous system already posted in our Pharma Syndrome channel. So please watch there and grab the knowledge.